So welcome everyone who were able to make it today. I think we'll, just go ahead. And even if you weren't able to make it physically today and you're watching this recording, we look forward to partnering with you. So this is the initial community partner meeting for the Change Training Program. And Change is the, training program really to enhance what the future researchers in HIV social and behavioral research looks like, and particularly in Miami, and thinking about the communities that are most impacted, and ensuring that whoever comes through our training program has a commitment to have sustainable impact within communities. And it is under or within CHARM, so the Center for HIV and Research in Mental Health. So we'll go over a couple of things today during this presentation and have a few discussions. So introductions, one in terms of who's here, then talk about why change. We'll go over the program description, the core competencies, community engagement experience, the timeline for training and involvement with community partners, and then we'll have an open discussion. So this is an image that shows, a lot of community partners within the Miami and greater Miami area that various faculty and teams have partnered with already here at but also individuals that we're looking to tighten and further build those partnerships with. And so some of you might have a logo that's already here or one that will be added in the future. But this just shows that we really want to be able to reach and engage with everyone to make sure that we are doing this work in a way that benefits community. So who's here with us today? And if you're here and you're a community partner, we'd love for you to do a brief introduction. And I also realized that I've been speaking and I haven't done one myself, but I am Dr. Dale and I am an associate professor here at and very much committed to community engagement. But who's here with us?
Let me get the screen up. Okay, can you see me? Hi guys, I'm Alicia Kamel McIntyre with Positive People Network, Inc. It's a social organization for people living with HIV and AIDS. There is Life After Diagnosis, Live It. We're a social organization, but we're also a service organization to the community as far as education awareness and educating about risk factors and just being a valid, included community member.
Thank you for being here, Alicia. We appreciate you being here and really looking forward to continuing to build partnerships because there are many ways in which you partner with various people across CHARM, myself included. So thank you. Do we have anyone else here that's hopped on? And we'll continue if not. Okay.
Yeah, I see Dr. Saavedra has just joined. So.
Sorry, I just joined and I was missing the initial discussions.
No, but you just joined just in time. We were just introducing each other.
Okay. So in terms of introductions, I'm Jorge Saavedra. I'm the executive director of the AHF AHF is AIDS Cell Care Foundation, Public Health Institute that hosted at the University of Miami. So.
Great. Thanks for coming, all right?
Yes, we're happy that you're here.
Thanks, Aisha.
And yes, likewise, just so many people that we partner with. I think I partner with your members of your team every other weekend. So, but okay, awesome. So let's move on to the other slide and give an overview. So this is an overview of the leadership for this Change Research Program. And so to the far left, you'll see Dan Feaster. Dan, do you want to say a few words about yourself?
Yes, I'm Dan Feaster. I'm a biostatistician in the Department of Public Health Sciences, but I have been working in HIV and substance abuse research for the last 30 years. And am really excited about this new opportunity to be training new people to be working in the field. So,
yes. And Viviana?
Yes, hi, I'm Viviana Origian. I'm a professor in the educator track here at the Department of Public Health Sciences. I have done research in substance abuse and its medical and mental health comorbidities. And one of the areas that I'm most passionate about and why I'm involved in this training program is capacity building and, you know, developing the future generation of scientists. So I'm glad that you were able to join today.
Thank you, Viviana. And I did an intro before, but so I'm also the director of the SHINE Research Program. And the work that we do here is really around community engagement around issues of mental health, HIV prevention and treatment, and really thinking about structural and psychosocial factors, be it discrimination and marginalization, and how those things are impacting individuals. And yes, I am strongly committed to thinking about how we can diversify the pipeline to make sure that the people with close proximity to the lived experiences are a part of the change that we need to end the epidemic. So why change? I guess I kind of hinted at that a bit, but ending the HIV epidemic is out of reach, mostly because the scientists and the researchers that we need to be able to look at what's actually going to reach the ground often face barriers. And the communities that are most impacted have multiple barriers that are being faced structurally, psychosocially, interpersonally, et cetera. And so the communities that are more adversely impacted disproportionately by HIV include the LGBTQ community, Black individuals, Latinx individuals. And if you see here on the right-hand side, the goal is really for individuals to be diagnosed, be engaged in care and achieve viral suppression. But those numbers are not where they need to be. Oftentimes people talk about the 90-90 goal in terms of we want to be at 90% across each of these indicators, but we're not there. And specifically in Miami, we're definitely not there compared to other major cities and states. And so needing to really think about how we could train the next generation of researchers working in this area, but train them in a way that the work that they end up doing and the work that they do while they're going through the program is consistently informed by and in collaboration with community-based organizations. So as much of Florida has the second highest rate of new HIV diagnosis among adolescents. And when you look at the left, again, it echoes who's being most adversely impacted. And when you look at the right, if you're familiar with Florida and various neighborhoods, you'll see that the neighborhoods that are in the darkest of orange are also the neighborhoods that are most marginalized in terms of race and socioeconomic status. So again, the need for us to always be thinking here locally in Miami about the sociocultural and environmental context and how that's impacting the work that's being done, and the need to really partner with community-based organizations who are on the ground within community to make an effective change. And again, this is some echoing, but there are a lot of gaps. So when you actually look at the various communities that are most impacted and you look at the right-hand side, you'll see the colors there. So the target being 90-90-90, where we want to be in terms of HIV diagnosis, care, and suppression, are the dark green bars. But then when you look at the other light green, orange, and yellow bars, that's where the various communities are, right, in terms of that target. And so we're well below target for these things in many of the communities. And so thinking about the need to really address, be aware of, and partner with community members in addressing structural issues around racism, homophobia, transphobia, poverty, violence, and co-occurring mental health. And this slide just, again, echoes like who needs to be in the workforce and who's currently in the workforce. So when you look at the HIV workforce breakdown here, you'll see that it's mostly populated by white cisgender individuals. And that is not who is most adversely impacted by the HIV epidemic. And so a program like Change that is meant to recruit and train pre-doctoral students and postdoctoral trainees around HIV research and science, and really engaging with community, has to be able to attract the individuals that's going to change what the workforce looks like. There's a saying by HIV activists, nothing for us without us. And when you look at this workforce, it definitely screams that work is being done for communities, but not by individuals who have close proximity to these identities. And that's likely what's keeping us from ending the epidemic. So, we're really interested in change, helping us to push the needle and being a part of diversifying the workforce here in Miami. Next. Okay, and I think this is where you're going to take over, Dan.
Yes, thank you. So the primary goal, this is a training grant, is to really develop the next generations of researchers and to specifically address HIV and mental health disparities in both HIV prevention and treatment. And the way we're going to do this is focusing on two linked areas. One is making sure that the trainees are very well versed in culturally informed interventions for racial, ethnic, sexual, and gender minority populations. And then also really making sure that they are familiar with innovative approaches to biobehavioral interventions for scaling up and linking and disseminating programs for PrEP, TASP, and whatever the community really finds to be of importance to address the problems that we're having around HIV and mental health. So the program structure is set up to build the necessary skills and prepare people for a research career, and particularly the pre-doctoral. They're just coming into graduate school, so they have a lot of courses to take, and we will supplement that with things that will prepare them. For the postdoctoral, these people will either have a PhD or an MD, and we will be working to help move them toward research independence so that they'll be ready to go out and be most effective. So we're going to focus on, of course, I'm being the biostatistician, I'm very interested in innovative state-of-the-science statistical and design methods. We're also going to focus a lot on professional development and mentorship and network building for the students and for the postdocs. But in fact, the central part here is community engagement and really getting them to understand participatory research. So the idea is that they will be linked and working in the community throughout their period of training here to really have a meaningful understanding of what the community needs and what it means to be a part of the community and defining their research and working with the community on that. So I'm going to hand it over to Dr. Horian now. So
yes, so thank you, Dan. So we have envisioned, training our students or our trainees to accomplish 8 competencies, and at the center is really community-based participatory research, but we think that it's critical that they learn on social determinants of HIV and mental health outcomes, that they have a robust training on the biological clinical foundations of HIV and mental health in prevention, care, and treatment. Dan alluded to the importance of professional development. They have to be skilled in writing, grants, but also on how to conduct responsible research, and to really challenge the disparities. We think that they should be equipped with the state of the science in methods, design and analysis. So, but it's also important that they are very well aware of the innovations that we are experiencing in the field as regards to assessment, intervention, and most importantly, implementation. We think that we are going to accomplish these competencies, or we proposed an approach to accomplish their development of these competencies, and that is based on some formal coursework, but they will also be attending different workshops that our institution has already set up through several institutional mechanisms. We have several seminars on mental health as part of the charm, but we are also going to be involving our trainees in weekly seminars, and those are tailored to address training in these competencies, and we very much look forward for your participation in many of these weekly seminars. As they go through our training, there's not only the involvement in community and in projects that are informed by community, which we will talk a little bit in the following slides, but they also have to be engaged in laboratory work, and that's how they gain their experiential training. So a little bit about the timeline. We are looking at two types of trainees here. We're looking at engaging, as Dr. Pfister was alluding to, pre-doctoral candidates, so fresh when they can come into their doctoral programs. And if they are really interested in advancing the field by challenging the inequities that we talked about, they will eventually apply to our program. And as part of it, they will be involved in, of course, structured coursework, the different seminars, the weekly seminars, presentations. But we are thinking that this trainees have to be very much involved in community, and that's where you see the conduct of CBPR, and that's happening while their engagement starts in the first semester. It's consolidated later as they start learning the different components of their training plan. We also including postdocs in our training program, and all of them will have to eventually build what you see here, a charm portfolio or a change portfolio, which is will have to include not only their proposal of their project that has to be community informed and developed in collaboration with the community, but this will also lead to presentations that we're thinking to community partners and in conferences, as well as publications. So that's part of what they need to accomplish. I don't know if Dr. Dale wants to cover this. I can take it on if are you planning to cover this?
I can go ahead. I'm right
Okay.
here. I can go ahead. Yeah. And so the idea here is that trainees will get to know a community partner, and depending on their level of training, so if they're a pre-doc, their programs are typically 4 to 5 years, so they may get to work in partnership with more than one org given that length of time, right? But essentially their engagement with the community partner would mean that they would get to assist with various tasks, including outreach, events, or just the basic foundation of how things are run within an organization, and to assist with grant writing. They will develop a project from these interactions, observations, and assisting with the various tasks. They will develop a project in partnership with the community-based organization about some question that needs to be answered, some issue that needs to be looked at, something that has to be addressed and intervened upon. And the idea is that this will come directly from that experience that they're having. And for them to be able to grow and learn and think about what they need to do to help implement change at the community level.
Yeah, so the way we were seeing this happening is, and this is where we want to really hear from you, because we might, this is how we are thinking about it, but we might be completely off. So now that you heard the competencies that we're trying to, achieve in these trainees, and the importance of community-based participatory research, the way we thought about it is structured on the following manner. The first semester, we thought the trainees will meet with the partners, will hear about what they're focused on, what are their projects, will attend to community engagement seminars and our weekly seminars, where you would be, helping us in train these trainees. But they will start, identifying areas where they could propose a project, or they could be linked with a project in their second semester. And you know, after they identify what is that potentially gap that you're facing, what are the problems that you're trying to address to inform their project and their question, then they will continue on to, you know, following semesters by dedicating, you know, hours per week in that project, and in refining the idea. Now, this is just an approach, and we have some experience with, you know, our master level students when they go and engage in the community and delineate what we call a field experience. But we want to make sure that we open the conversation so that you can help us delineate each semester, what would it, you know, based on what you heard, what would be expectations that you would have from these trainees as we help them accomplish these competencies? Like, you know, this is how we're seeing the engagement process occurring, but you might have different ideas on how to get there. The other thing that we want to hear from you is, you know, we have envisioned a project that would be a research project informed by the community, but we would like to hear on what are the different activities that you might need support with beyond of what we have thought so far. And I think that at this moment, I would like to open it to the group for discussion.
Good afternoon, everyone. This is Alicia.
Can we unshare? Sorry to interrupt you, Alicia. Can we unshare so we can see who's? Okay, thanks.
Go ahead, Alicia.
Okay, so I'm really excited about what you guys are doing because it's phenomenal. It's inclusive of the community as well as the people being served. So kudos for that. One thing I am passionate and compassionate about is language. So a lot of times people who live in conditions or engage in certain activities, they put an emphasis on the condition or the activity. Reducing people to one thing that they have or do. So we want to change it to people first language and putting the person before the condition, which changed the narrative. So that helps with ending stigma and just better quality of life. So we definitely have to incorporate that, even if we have to be the one training on that, which we don't mind, but definitely in being inclusive of everything about the community, that language component is very important.
Sure.
Absolutely.
And I think we could all use some work on that. I mean, I find myself, having been in the field for so long, things have changed.
Yeah.
And I think I would say that points out part of what I was seeing that this would hopefully be, is that this would be a chance for the students to, for a period of time, and an ongoing period of time, to be embedded, to work with you and or others in your project and in your group, to understand what the issues are, and to be socialized to some extent, to understand what it means to be respectful of the community and to work closely with the community.
Yeah, and I think the other thing I'm hearing too here, that I think when Viviana was talking, she was kind of saying some of the things that the students are going to be involved in. And Alicia, what you're bringing up is that in the seminars that we're having for them, like, it would be an easy thing to literally have a seminar that's around language, yes, right? And language as a tool of empowerment, but also as a tool for stigma and how we counter that. And we could address both language in terms of people living with HIV, and also language around LGBTQ identities, language around immigrant identities, like, you know, because I think there are a lot of nuances, and it would be great if, for instance, we have trainees coming in, the first time they're being keyed up to the awareness around that is not when they're with someone in community, because it might, you know, be a might progression. But yes, so I think we could do that on our end, but also that could be something beautiful that they'll naturally be embedded in and learning when they're with an organization. But we could do our part by making sure they have exposure prior to. Thanks, Alicia.
Absolutely. Also, another beauty of it is, you know, for me being a person living with HIV and have been, when I was first diagnosed, being traumatized by, you know, because it was new and everyone was just learning, and had I had a weaker disposition, I don't think I ever would have got treatment. You know, I hear that from a lot of our clients now. The worst experience they had was with the people who learn about this stuff. Like students, and they're learning about it, but this also gives them the opportunity to say, hey, this is what you want to do. Are you sure? Well, this is what it looks like, and this is who you're dealing with. So I love that. Get them prepared, and that will be better for the community being served as well. You know, empathy. It's a small thing, but if you don't have it, it can damage people.
Yeah,
Sure.
absolutely.
Yeah. Jorge, thoughts or Hansel? And also, Alicia too, because you're commenting on the language, but I bet you also have ideas on the other pieces, like what are different tasks and things that you imagine that students would be involved in, or the kinds of things that you guys would hope they would be involved in if they were to be paired with you or working with you?
Okay, so with us, we're social organizations. So we do social activities as well as social activities. We do food distributions and we do awareness day events. So partnering with us, like Women and Girls, National Women and Girls HIV/AIDS Awareness Day, Black Awareness Day, World AIDS Day, long-term survivors, all the awareness days will be an opportunity for them to hands-on see what it entails and learn and get more acquainted. So we do that, as well as just understanding that we are people, we're not the condition, and it's not contagious. And I'm telling you, a lot of doctors act standoffish and are trained on universal precautions and all of that. So the hands-on experiences and just to be a part of is appreciated. And whatever else that may help, because I'm partnered with the agency who's doing MSM, intervention on MSM, which is great. That allows her to understand the MSM community, gets her to understand what that means to them culturally, not title-wise, culturally as well. You know, just because a person is MSM, what does that mean? It's just not basic men that have sex with men. There are other components to it, and getting to know the person. So yeah, I'm excited for you doing this and being a part of it, because that's the only way we're going to end the epidemic. Like you said, meaningful involvement of people with AIDS, MIPA, and GEEP. You know, all of that has to happen, and all of that has to take place. And this is a step towards that. And I commend you guys on this. I can't say it enough, because that's what needs to happen. If you test and treat people, that's fine. What are you going to do with them mentally, or about housing, or the disparities that affect them? You could say, okay, you got HIV, here, go to pill, go live your life. Really? How am I supposed to do that? You know, cover all angles.
Thank you, Alicia. Jorge?
Yes, Anisha, probably you know better what the HF is doing in terms of activities at the community level. But I will just address one of the issues that has been a lot of concern for AHF here in Florida, especially here in Florida, but also in some other states. It is the point of why people are not retaining care. What are the factors? What are the issues that they leave care, and then they don't continue with treatment, or they don't even seek treatment anywhere else? So, well, of course, the first assumption could be that they feel better and they don't feel there is a need to continue to be in care. But that's a big issue for us at AHF, why they are not coming back, or why we cannot keep them in care. What are the factors? What are their expectations from a healthcare service provider to retain there, or to remain there? Those issues, I think we need to understand them better why people leave care services. I mean, of course, there are many issues mentioned by Alicia that may play a role, but might be some other issues as well. I mean, we need to understand them carefully. And I know that in some cases, it has to do with substance use, and probably those factors are playing a big role here, especially here in Southern Florida. In order to understand better, I think we need to ask them and involve them. But many of them, they don't want to be involved, actually. They don't want to be disturbed on those issues. What we have been doing is providing them some incentives to tell us why, the reasons why. So we have been conducting interviews through the phone, especially with the ones reluctant to come back to care. And that means they need an incentive. So we are giving them gift certificates for a higher amount of resources, so they can be incentivized to at least answer a questionnaire in order to know why they are not coming back. Sometimes are issues related with the service itself, but sometimes are more personal issues. They don't want to disclose, they don't want to say it, or they feel embarrassed about saying. But sometimes when we provide those incentives, finally they start telling us what is the truth behind that kind of behavior. And as I said, many of the things that Alicia mentioned, they play a role, but there are some others, like losing the health insurance, for example.
Yeah.
But they feel that if they don't have health insurance, a private health insurance, that means that they don't have access to treatment. And they do, but there are some other mechanisms that they are not aware that can be used in order to remain in treatment. So I think we need to also get involved with those kinds of people. I won't say those kinds of people, to people who have been, for different reasons, absent from the care services. And I'm not just saying AHF care services, but other care services.
Sure.
And therefore the risk of getting like the viral load not anymore under control is there. And then therefore there is a situation there that needs to be addressed. But first, in order to address it, we need to understand.
Yeah.
And so, Jorge, if you were to imagine trainees being placed, you know, in different HF kind of settings, what is the potential kind of activity? So it sounds like you guys are doing follow-up interviews with, you know, clients who are lost to care, to being retained. But I also know you guys do a lot of HIV testing via your mobile units. You provide care when people come into you. Like what ways do you imagine you know, our trainees would be both beneficial to you and be learning a lot if they were to be kind of inserted? Like,
yeah, well, one of the ideas will be like, okay, to get engaged with some of the new retention strategies that AHFs will start to develop, is just starting to develop, and that will be a lot of help and a lot of learning opportunities on how someone remains in care. And sometimes there are simple issues, like just like calling you by your name instead of just a number or just next one. The other ones can be like more directly getting in touch with them, like being like recognizing the importance of the patients in a clinic. But those kinds of strategies, sometimes they require this human touch. The other one is linkage to care, of course, after being tested for HIV positive result. But in those cases, what we have found out is that the people that we have officially in charge of linkage to care are the ones who the patients trust the most. They feel that, okay, since they were involved since the testing and they were involved on getting them into care, they usually tell them more things that they tell like the provider, like that they tell the rest of the AHF staff. They don't tell a lot of things that they tell to the one who linked them into care, because that's the first one, I think, that they started to trust, and they trusted them to get them into care. And now they trust them for everything. And they keep calling them to tell them, okay, I am not satisfied because of this waiting time or whatever. So I think the role of linkage to care being a double kind of role, linkage to care and retainer in care, can be very helpful. And I think that can be a very good opportunity for learning of the UM students.
Sure. I mean, it actually sounds like a potential intervention or sort of restructuring of how to do things.
Yeah.
Awesome.
And that is one of the things we would hope that students would get from working with you and or people in your organizations, that they would start to see some of these things and talk with you and the teams in the various community groups about what is a problem or what isn't working for people, and how could we change it, and how would it make sense to change it. That's part of, they should have, that we're hoping we're going to be able to train them to have the skills for how to put it into the framework of a study, but they really need to go to the community to find out what are the issues.
So Dan,
and what's going to work to address them in the community.
One question I have, and probably Sanisha already knows this, but I don't know the answer, or probably Viviana. So for students to get opportunity of getting some learning experience from the field at the AHF services, will that require like these services be kind of get some university accreditation beforehand in order to be places where students can learn from? Is that like a requirement? Is that, I don't know. I mean, I know that for hospitals that's a requirement, but these are kind of more community services in terms of they are just providing outpatient care. So they are not really academic fields, but I do think they are very good for learning experiences for students, that they can learn a lot.
Yeah. So for this training grant, these are not structured as credit earning courses. The experience in the community is just central to the training of our students. For the master's students, yes, field experiences are a course, and they earn credit for, they earn 3 credits for those courses, and they have to do service. So these are not structured so far as a course. I'd say so far because we might want to, I wonder if you want to change it eventually, Dan or Sanisha. What are the thoughts?
Yeah, I think,
go ahead, Dan.
I was going to say, I don't think it needs to be a course, but I would reframe that a little bit, Viviana, in the sense that our normal graduates, some are on a fellowship for a year normally, but then after that, their stipends are paid by faculty research, and they have to work on a research project. Here, our students are being paid by our training grants, and we are assigning them research-related work, which we want them to do in the community. So while it's not a course, it is a requirement
for the training program. Absolutely.
For the training program. So I agree, it's not a course, but we can put more structure on it as a training component.
Yeah.
The other thing I would say is that when you're saying that, do the organizations have to be accredited? The other thing we're always going to be mindful of is what's a barrier versus what's a facilitator to promote these partnerships. And so we wouldn't be asking for some extra accreditation for the community-based organizations themselves, but we would say that if there's a task that the trainees are being involved in, that they get the training and supervision that's adequate for that. Like, so for instance, if a trainee is going to be involved in testing, then of course they would have to do the Department of Health, like HIV testing and counseling training, right? So I think that is probably one of the core things is that any task and things that they're doing, we would expect that they're going to be trained and supervised adequately for it.
Yeah, at AHF, actually, we do training of people in order to do a rapid test on what procedures to use, how to do it, how to provide the result. We have been doing that for a long time. Now, in terms of the other part of retention and linkage to care, we don't necessarily train on that, but people who are involved learn a lot. But my main concern was, okay, if someone goes to an AHF site, of course, they will have opportunity to meet people and to meet patients with HIV, but then I don't know if when you meet someone who's HIV positive and you are going to know the status because they are arriving there. I don't know if that for the university is kind of, okay, we need an IRB approval before starting to do that. So I don't know. I mean, it is not an AHF issue. It is something that sometimes we realize that are required by the university, that they require this and this and this to be done before starting to do something that is related with the training or learning of students.
And that's a good point. And as we are delineating, the structure for this course or for the experience, some of the requirements we might want to set up front. But in terms of IRB, unless the students are engaged or using data for the purposes of research and it's considered human subjects research, we typically don't submit to the IRB. But if they're gonna be, adventuring on projects that are for which that are considered human subjects research, then yes, they will have to obtain IRB approval. So at this moment, that is a university mandate. We don't mandate that. At this moment, we have not set a structure of our own requirements from the program for their involvement in the community. We were thinking probably that completing a proposal of what would be their activities as they engage with a partner would be a good idea, so that the expectations from the organization are spelled out and by the student are spelled out, so that at the end of the day it doesn't happen that everything gets diluted and activities are not accomplished or follow through. That's an idea or a model that we can embark on, like a firm proposal by the student, an agreement signed by the partner and the student. I'm talking about the student, I'm talking about the candidates or the trainees, but it's up to, has not been set. So it's up to our decision.
It's a way we could formalize things.
Exactly.
The other thing I would think too is that document should be amendable and not like something, oh, this is the only thing we had talked about in the beginning, so this is the only thing I do. Because I think by the nature of community engagement, something might happen or a new opportunity might come up, or the students like, oh my God, I met this other team member and they're doing this, and they asked the partner if they could do it. So I think if we do decide to utilize kind of like an overarching agreement like that in terms of potential tasks and duties, we should leave room for that to be to an addendum to be made to that, just because I wouldn't want the students to miss out because that wasn't in the scope of what was talked about in the beginning.
Yeah, and actually that's a great point, and that's exactly, at least at the master's level, is how we are handling it. Things can change, and always change. A new funding opportunity comes about, a new need emerges as a crisis, So, but if we frame it in terms of what are the different competencies that the students will be accomplishing with their involvement in the with the organization, then it's amendable.
Right. And I think with the framework for the T32, with us meeting with the students weekly in the seminar framework, this may be less of an issue, but I know in the master's program, part of this structure is also to make sure that the student knows what they are expected to do in terms of what need, you know, that they need to actually go in and do some work at the agency to understand the agency. It's not just a matter of they go in and just do whatever it is, you know, that they want to do, because it needs to fit within the goals and the framework of the agency as well. So I agree, it needs to be flexible. I don't think we want to lock people in, but it's just a matter of it's a starting point.
Exactly, providing some, you know, some level of structure.
Right.
And thank you. And Hansel, do you have any thoughts? Are you there? In terms of, you know, one, what kinds of activities do you foresee a trainee, be it at the pre-doc or even the postdocs will have to do this, being able to engage in at IDEA, and what would be things that you guys would hope for on your end?
Yeah, so tenured Professor Dale, I think that
You're so funny.
it would be fantastic to have the trainees at IDEA, because what Alicia was talking about with the person first language is something that we've really emphasized in our, so I deliver the substance use disorder and the HIV curriculum now in the medical school. And we always make sure that the person first language is central to everything. Everything, like, we're just trying to teach them from the beginning not to stigmatize patients any more than, you know, the stigma that people are already facing in the community, whether that be from race or HIV status or whatever. So one thing that we've done is, so Alicia said meaningful involvement of people who are living with HIV. We always include patients who are living with HIV, patients with substance use disorder in all of our activities. So there's always a patient panel. They're always with us as we're planning the cases. So I would be really excited to have people visit the IDEA Exchange, and perhaps we could develop like a mini primer, or maybe we could even go through the case that we deliver to the medical students with them that really emphasizes the importance of person first and non-stigmatizing language. We can definitely have people at IDEA. We're part of just send them. Like, there doesn't need to be anything. We can get it going, and particularly, you know, they'll have access to structural racism, racial disparities. They'll have access to people with substance use disorder. They'll have access to people who engage in sex work. So we really have a very diverse community that we serve. I'm just thinking. So I'm actually on the HIV service right now, and I was wolfing down my food. That's why my camera was off. So I apologize for being late, but I would be eager, if it's okay with you all, to bring people into the hospital, because I think it's so important to see that there are still people, Black people, dying of AIDS every single day in the state of Florida. And it hurts to say that, but I have these patients.
We know it's true
right now. And it's important to see it. I think that it would give them more context to why we do this fight. And we were talking about people falling out of care. I mean, COVID just like destroyed everything. So many people who had been in care for so long, you know, weren't able to do their Ryan White re-enrollment. So they just, you know, gave up and fell out of care. So we're seeing all of that now. I would be really eager to have our trainees round on team one, because it is so, you know, devastating, all the preventable illness that we see in the hospital. And just finally, the I don't know, what was I even going to say? Now I have itis because I just ate. The substitute people, I forgot. But yes,
so I think you're saying that we could treat Jackson as a community, like, you know, IDEA Exchange, but also think about treating Jackson and the clinic as a community partner in that sense, of terms of students being able to go in there, and again, paired with the right team, the right person, to be able to get them that experience to understand how the disparities are playing out.
Yes, thank you, Dr. Dale. I think that would be I think that would be great. I think there should be an element of Jackson as a community partner, because the things that, particularly in the hospital, because it's a very unique experience to see what looks like the cover of Time magazine in 1988 regularly as you go room to room on rounds. The good thing is that they don't die, and we were able to treat them and they survive. But I would like to do that. The other thing that I was just thinking about is at IDEA, they're going to see the side of HIV care, the innovation, and really the way that it should be. All of the emotional support, all of the administrative support, all of the white glove concierge approach that we give to our patients at IDEA. You know, it would be my hope that every patient that I see in the hospital, I almost wish they injected drugs, because then they would be part of my team and be able to give them the entire like wraparound engulfed support. That's why, you know, our myelosuppression is so high. I think that it's important to see that with a little bit of effort, we can support people in maintaining their mental health and their viral suppression and all those things, but then also to see all of the holes in the system. So I would be eager to have people on rounds as well.
That sounds wonderful, Dr. Tooks, but also
Hi, Alicia. Hansel.
Also on the other end of that spectrum, show people thriving and living and doing productive things, because it's not a one type of person that's living with HIV. I'm living with HIV. I'm not a patient. No one is a patient. It's a person living with HIV. That's also one of the stigmatized language. Patients would refer to a person in a hospital bed. I'm not in a hospital bed. So to say I'm a patient, I'm a stickler for that language thing, Mr. Tooks. I'm definitely a stickler for that. And that's one of the stigmatizing is that no one must be referred to as a patient. Person living with HIV, new language, period.
Right.
I had a feeling, you know,
yeah,
as soon as Alicia started,
Yeah.
no, I had a feeling when Alicia started, I
You
swore
already
were gonna,
knew.
I thought you were going to say the motto. I swear you're going to say the PPN motto. What you always say, huh?
Listen,
No, I knew. I was
I'm
like,
being
she's gonna
reserved,
say,
but I'm
this is
still
what
being
life
Alicia
after
at the
HIV
same
looks like. No. But no,
Exactly.
You're right.
So,
We should have people in clinic as well, because when you're on the clinic side, and that's why I always like for the students to see inpatient and then see clinic, because even the same patients who, I'm sorry, Alicia, for saying that, they're my patients when they're in the hospital. So I'm billing for them right now. You know,
start calling me your peeps.
but I think it's the full spectrum. I think what you guys are getting at here is that in the same breath that we want people to understand the full context of the lived experience of people living with HIV in terms of where people live, what they have access to, what's broken in the system, what needs fixing. We need to show them the full diversity among people living with HIV and different stages people go through. Like, people are healthy and only showing up to their doctor once a year because, hey, I have that checkup, right? And then there are people who have different struggles and might show up in a hospital bed where Hansel's taking care of them. But to show people that HIV doesn't determine your lived reality if there are resources and structures put in place to help you thrive, right? Yeah.
Denise, would you mind being my translator everywhere I go? Like,
yeah, but I think that this is the theme of today. Like, you know, as you were all talking, and unfortunately, I have not created this structure, but it's called patient-centered research, or, you know, maybe we should call it person-centered research. But this is what I think that the theme that the three of you brought about, which is how important the life experiences and the person is wherever they show up, and how that can shape the research projects or that our trainees embark on, and definitely has been, you know, a focus of some of the federal funds years ago, and that's the direction. So, and apparently you are voicing that that's the need, if we are ever gonna battle or challenge the disparities that are persons living with HIV are facing. So I think, are we at the end of the hour?
Yes, we are. Right.
I actually really thank the three of you for joining in. I know everybody's super busy, but also for sharing what you see is important as our trainees go through the program.
And our hope is this, right? So in terms of timeline and how things are going, we're building in the nuggets. The trainees won't start until mid-August in terms of starting coursework and going to seminars, etc. There are going to be seminars that are built in for them in the fall. And based on some of the ideas that you guys have actually shared here, we could tweak some of the content of those seminars so that they're better prepared when they come to the community partners. The idea that most likely they want to initiate with a community partner early in the first semester, so not early in the fall, but there will be a speed dating almost like with community partners where we'll invite you guys and different community partners to come, and the trainees will be there. And that way you guys can get to know each other. And then we can make a match in terms of the trainees being paired with the community partners. And definitely by, early next year, so early January, we want them to be able to start actually being in the community organization and volunteering with you guys. But if there are questions that come up between now, and the end of the summer or early fall before you meet them, let us know. If there are ideas that you have after getting off this call, let us know. We definitely want to ensure that your voices and the ideas that you're bringing up help not just to groom the trainees, but to inform the training program itself. Right. So, thank you guys, and definitely let's keep talking.